All right, time for Medical Monday. Dr. Elizabeth O'Connor with Bay Care Clinic. This is a topic that got so much discussion in our newsroom when we knew we were talking about it, a mommy makeover.
Yes.
What is this?
Well, this is really just a popular term, and it refers to combining a variety of procedures into one surgery, with all the procedures geared at restoring your pre-pregnancy figure. And the nice thing is you have one surgery, one recovery, one downtime, and then you get back to the kids, the life, the work, all those things that we need to get back to faster.
You do it all together. So if you are thinking about certain surgeries, you have the option of doing it together.
Yes, you can combine it into one surgery, and then you don't have to keep going back to the operating room.
And having the recovery time.
Yes.
Okay, so what types of surgeries are we talking about?
So usually this involves combining a breast surgery with a body contouring surgery because those are the ones most affected by pregnancy. So breast surgery is most commonly a breast augmentation where we place an implant under the breast and it restores the shape and the volume. Also a breast lift is very common and that kind of reduces that loose skin and lifts up the breast. We can also do a breast reduction because some people after having several episodes of hormone changes actually have enlargement of the breast, and that's back, neck, and shoulder pain for many people.
Okay, so all kinds of surgeries do involving the breast, but then what are some other popular ones?
So also we usually combine it with a body contouring surgery. This is most commonly a tummy tuck or abdominoplasty.
Yes.
So
I like the contouring word better. That sounds better.
Yes, we remove that loose, fine, crepey skin that's been stretched and it's lost its elastic properties.
Yes.
And so we can take that and tighten it up and remove it. We can also tighten those muscles because many of us get a rounded appearance after having babies. The muscles are spread apart, your abs, your
It's just not the same.
And it won't go back.
No, and that's what everybody says when you have kids. You're never going to be the same, and this is going to help you get maybe closer to where you want to be, right?
Yes.
So who's the ideal candidate? Who should be looking into this?
Well, really anyone that's done having kids, and we like to wait about 6 months after having completion of breastfeeding.
Okay, so there's a good reminder for people too. You can't do it right after you have the baby.
Give it a few months to recover.
Make sure you don't want any more
time.
kids too.
Yes.
Okay, what's recovery time like? You know, we typically hear about these surgeries individually, but doing them all together, is it more painful? Is it more recovery?
Not really. We find that it varies because this is kind of tailored towards each patient.
Okay.
So some people have 1 or 2 surgeries, some have 3 or 4 combined, and so it can be anywhere from 1 to 4 weeks of recovery time, but it really varies person to person.
Is this becoming popular? I mean, how have you seen it increase in the last couple of years?
It's very popular. This is one of the most common things that we see women coming in for is really these procedures to recover after having kids because we're all affected.
Yes. Did they come in and say, just put me back together?
Yes. Well, after 9 months of being pregnant, we all expect our bodies back, and we get them back, but they're a little different.
They're just not the same.
Yeah.
This is going to help get you there.
This will.
All right. Sounds great. Thanks so much for being with us, Doc.